Good day, everyone, and welcome to the 10th session of UPM SILab's IOL 101 Webinar Series 2025. I'm JR Pingol, and I will be your host for today's webinar session. We at UP Manila Standards and Interoperability Lab, or UPM SILab, envision achieving universal health coverage through digital health capacity building and appropriate use of digital health technology. That's why we are bringing you fresh topics, diving deep into the latest trends and challenges of digital health and interoperability. So I invite you all to join our weekly IOL 101 webinar series 2025. This year, our goal is to empower our community with knowledge about digital health. To achieve this, we have launched a weekly webinar series, IOL 2025, that addresses trends and challenges in digital health and interoperability, particularly in the Philippines. The series offers foundational knowledge from local and global experts through IOL 101. Additionally, IOL 201 features insights from our Community of Practice or COP members in community-led sessions. We are grateful to partners, CSIRO Australia for their support through the Strengthening Standards Capability Project or SSCP, and to the DOST PCHRD for their collaboration in our webinar series. Today, I am honored to have everyone here as we explore the transformative subject of IOL, a patient's journey with NAH Digital, Enhancing Care, Personal Health Records. This presentation will cover how technological advancements are reshaping the patient experience within the United Kingdom's National Health Service, or NHS. It will discuss important digital tools like the NHS App, which facilitates patient interactions, improve communication among healthcare providers, and increase access to care. Additionally, the conversation will emphasize how general practitioners, hospitals, and pharmacies work together digitally to ensure a seamless integration of services. Again, thank you for joining us, and we look forward to an engaging and informative session with all of you. Okay, but before we proceed with our session, this is just a quick rundown of our house rules. Okay, this session is being recorded, and by proceeding with the meeting, you are consenting to be recorded. Kindly stay muted throughout the lecture. A new virtual background has been provided to your email, so turning on your camera is much appreciated. We encourage everyone to please change your name for proper identification. Add your affiliation beside your name for proper recognition. An example is shown on the screen. We want this session to be engaging and interactive. There will be a Q&A portion after the lecture, so please actively participate and don't hesitate to ask your questions. Again, we have three options. You can use the raise hand function and unmute your mic. You can type in your questions in the chat box, or if you want to ask anonymously, you may use the Q&A button. Please do not leave the session after the Q&A as we will be having our group photo taken. And lastly, this is important to receive your electronic certificate of participation. Do not forget to complete the evaluation form after the session. And please note the following criteria to obtain your certificate. A minimum attendance of 30 minutes is required to ensure attendees are present for the majority of the session. Attendees must be present during the picture taking. Participants must complete the post-evaluation form by noon or 12 p.m. And lastly, the attendee's name in the Zoom meeting must reflect the name to be printed on the certificate. Okay? And to move on for Community of Practice or COP, we would like to invite all of you, especially new friends and colleagues, to join UPM SILab's Community of Practice. Our Community of Practice is a group of experts and practitioners all passionate about advancing standards and interoperability in healthcare. We share valuable insights, tackle challenges, and work together towards creating and sustaining healthcare solutions. Please join our community. Everyone is welcome. I will be pasting the link shortly so you can sign up to receive our newsletters and join our WhatsApp group. Or you can scan the QR code on the screen. All right. Okay. And so for today's agenda, may I introduce our speaker for this session of IOL 1. Okay, our esteemed speaker is currently in his final year of medical studies at University College London or UCL and is preparing to transition into his role as a resident doctor in London. As an NEH clinical entrepreneur, he has co-founded an innovative startup dedicated to enhancing care for individuals with ADHD, utilizing evidence-based practices and cutting-edge technologies. He also possesses valuable venture capital experience where he has played a key role in evaluating and screening emerging health tech startups that aim to revolutionize patient care through technology. His research focuses on exploring the implementation of digital health interventions in both community and secondary care long COVID clinics, employing the normalization process theory as a framework to understand how this intervention can be effectively integrated into existing healthcare practices. With a profound interest in digital health innovation, he is committed to harnessing technology to improve patient outcomes, streamline healthcare processes, and ultimately enhancing the efficiencies of a healthcare delivery system. Through his effort, it aims to bridge the gap between technology and clinical practice, ensuring that patients receive the best possible care. Now, without further ado, to present a patient's journey with NEH Digital, enhancing care personal health records, let us virtually welcome Mr. Vinosh Jegatheesan. Over to you, sir.
Thank you, JR, for the introduction. I'm just going to share my screen. Okay, so welcome everyone. Hope you're all keeping well wherever you're tuning in from. Today I'll be speaking about a patient's journey with NHS Digital, enhancing care through personal health records. And the objectives of today would be to explore how digital tools impact the patient's journey in the NHS. We'll be discussing how patients navigate the system, the challenges they face, personal health records, and how technology is shaping the future of healthcare delivery. So a bit about the NHS, so that you're better sort of up to date about how things are run here in the UK. So the NHS is a national health service, which is free at the point of use, and it's funded by taxation from money from people, the taxes they pay. And patients can interact with the NHS in three different ways, as seen in a diagram. So there's primary care, which is the GP practices that help to manage long-term conditions, routine healthcare checks, and referrals. Then there's secondary care, which is your hospital services, where they would go for specialist care and surgical-based procedures, which are often a referral base from their primary care clinic. And then finally, there's urgent care. This is accident emergencies. They can call 999 on the phone in an emergency, 111 for guidance on urgent but non-life-threatening issues. And throughout these three sort of areas, digital tools are being increasingly used to help patients access services faster and more efficiently. So how do you get registered? So every UK resident has a unique NHS number, as seen just here on the letter. It's usually assigned when you're born in the UK or if you have migrated from abroad. And it's really important for your medical records. Patients must register with a GP practice in primary care based on their location. And they can find this quite easily via the NHS website. And all they have to register for practice is a proof of address and an identity card, whether that be a driving license or passport. So the GP practice is really important for patients because it helps to manage their routine care, referrals, and prescriptions. And registering means that there is continuity of care, and records can be stored and referrals can be managed appropriately. Of course, there are some key issues in the UK with GP shortages, especially in sort of more rural areas outside of major cities, meaning that patients do struggle with registering with a practice in some cases. So how do GP practices work? So they serve as the first contact point for many patients for most health concerns. And the team is comprised of reception staff, which help to handle the bookings and patient records. There are also doctors, nurses, and pharmacists in the practice who help to provide consultations. And the general goal here is to reduce waiting times, improve efficiency, especially with digital tools, but they're not always as effective, as we will touch later on. So usually this is a sort of like a flow diagram of how it would work. So they'd phone into a surgery or through an app, and then they'd either get to see a patient, the doctor face to face, or they might manage their care virtually over the phone. So this is the NHS app, and this app is really important for patients to help manage their care independently. Some key features of the app are that they can book GP appointments without having to call the reception. They can order repeat prescriptions with one click. They can view test results and medical records. And finally, it's embedded with the NHS 111 symptom checker for self-triage. Of course, there are challenges with the NHS app. So some patients struggle with the setup or they forget passwords. And sometimes the app does not always sync properly with the GP records. So this is just some numbers here. So we can see that there's quite a lot of people registered with the NHS app, especially on after the sort of COVID pandemic, and there have been many sort of GP appointments booked. So this is the NHS app. So we can see here I've taken some screenshots just as a patient's point of view. So as I log on, this is the left-hand side shows the page that I will be shown, and I'll be shown my unique NHS number in case I need to refer to it at any point. There are a range of services, so I can request repeat prescriptions, I can call someone, and I can also look at my own sort of personal health record as well. There's a wide range of services accessible through the NHS app. As I mentioned, requesting repeat prescriptions, contacting my surgery, and looking for appointments as well. There's also other health information that can be accessed as well. So things such as medicine information, health information, and COVID guidance. And this is kind of what it would look like on this side in terms of the health records. So I can see that I can, on the fourth screenshot, I can see a bit more about past appointments, test results. I can view my COVID vaccine records, and I can also look at my care plan. And then finally, on the right-hand side, is a messaging function where I can get up-to-date information from my GP practice or my hospital. So as you can see, the functionalities of this NHS app is very user-friendly. It's quite easy to navigate. It uses very simple sort of formatting, so it's easy for patients to navigate. So now this is the personal health record section within the NHS app. So on the left-hand side, it'll have sort of details of the patient, and this kind of would be the landing page. So I can have a look at my allergies, what medications I'm on, current health conditions I have, and test results. So by clicking on the health conditions, it takes me onto the second page here. And I can just, you can see, for example, I've had vitamin D insufficiency, which is quite common for people in the UK with a lack of sun. And so I'm able to scroll through to sort of past problems as well, such as palpitations that I've had in the past. Then I can easily access test results, which is quite useful, especially because it doesn't mean that I have to get in touch with the primary care practice directly, and means I can, not add on to the burden of the calls that they might have. So I can see that I can click on my ECG results. I can have a look at my full blood count, various sort of tests that they might do in the primary healthcare clinic. What's fascinating about this as well is that they translate the medical jargon into something that a patient would really understand. So there is an information section within the full blood count section where they are able to explain what the results mean for me as a patient without having to go through complicated things we might know as medical professionals. Then the fourth page is a bit more about the consultations. So patients have a right to access their personal health record legally. So the record will show personal data, and depending what the GP surgery shares, I might be able to see the consultation notes, my medical history, and a test that may not have been discussed with my doctor yet. Um, so for example, here, this is the recent consultation I had with my doctor, and I can see exactly what she had written. So the problem, the management plan, and any comments. And then finally, on the right-hand side, it talks a bit more about the documents that I can access. So virtual letters from the primary healthcare clinic or virtual hospital letters as well, referral letters, discharge letters. So that's a bit about the personal health record. There's also other features in the NHS app that can be used. So the messaging function is what I've touched on earlier. I can also, on the second page, manage healthcare services for other people. So by getting in touch with my GP surgery, I can request to have access to someone else's healthcare services, whether that be my parents, my grandparents, siblings, partner, and that will give me access to their services so that I can, for example, get in touch when they're not able to. And this is very useful for those who are potentially vulnerable or not sort of digitally enabled like the younger generation. It would require the GP getting in touch with the GP practice and getting permission from the person you're accessing their personal health records for. You can also make health choices, so in the middle side, which gives patients a lot more accountability for their healthcare. So one thing that we have is an organ donation decision. So it's a opt-in system where, for example, you'll all automatically be opt out, but you may choose to donate organs if sort of things come to us for your health. And you can make those decisions quite easily on the NHS app. You can also be part of healthcare research. You can also share records with others. So there's a lot more sort of autonomy for patients with their health choices through the NHS app. And then finally, on the right-hand side, I can access all different kind of medical problems through this easy NHS website that is linked to the NHS app, which is a sort of a pop-up when you click on it. And it allows me to go through different conditions as a patient and explain it without sort of medical jargon in an easy to understand terminology in terms of what my condition might be. For example, if I have high cholesterol, what it would mean to me as a patient, and what things I can do to better help my control the condition. So I think what's amazing about the NHS app is that it's all interlinked really well with tools that GP practices in primary care use. So for example, if I do want to get in touch with the GP clinic, I could do so quite easily with the NHS app. The traditional web method would be to call up your GP practice using the phone. However, this has proven to be a very long method because it would result in long waiting times for patients and a backlog of patients due to the high demand. So they've created what we call patches, which is a text-based system where patients can submit their symptoms on or admin requests online. And for the GPs, they can triage their cases and respond online or arrange a call. The pros of this is that it reduces phone call congestion at GP practices and helps prioritize urgent cases. However, GPs can receive too many requests on this, making triage difficult, and patients sometimes overuse it for non-urgent issues. Then on the right-hand side is AccuRx. So this is a secure messaging system for healthcare, and it's used for GPs to send test results or referral updates via text message. It allows patients to ask questions or share updates. So for example, if you had a skin condition that you wanted to see your GP about, very easily the GP can send you a text message via AccuRx, and there will be a link where you can click the link and take a photo of your skin condition, and the GP would be able to access that virtually without you having to go into practice. Um, so I guess there are some issues that come with AccuRx. So because of the amazing technology that AccuRx has, Some patients do expect instant responses, which adds to the pressures of doctors. And not all practices have this integrated into what their workflow is properly as well. Then talking about secondary care, in hospitals, we use Epic in terms of patients' notes. And hospitals and GPs can always share the patient data, but the process isn't always as smooth. Um, After your care in hospital, you will be sent an electronic discharge summary, which is the discharge notes of your stay, what the management plan was. And this could be sent to your GP electronically or in a paper format. Um, and within the hospitals, specialists can also receive e-referrals to their GP clinics. For example, if they had a heart problem, they can be referred to a cardiologist specialist. Also, for the primary healthcare clinic, it's great because the GP records are automatically updated with latest test results. So, for example, if you've had a full blood count test done in the hospital or a chest X-ray, that will be automatically updated into the GP's um, system as well. Of course, there's also problems because IT systems don't always communicate the best, depending on what trust you are, which may lead to further delays in patient care. So, in terms of the patient's point of view, there are quite a few frustrations in the journey. So, there are booking issues. So, it's really hard to get GP appointments, especially after the COVID pandemic. Online booking systems with patches, for example, tends to book up quite quickly, leading to long wait times. So, patients will often have to be on their phone ready at 8 a.m. to quickly get an appointment. There can be long waiting times as well. So for routine appointments to see your GP, it could sometimes take days to weeks. And with specialist referrals, sometimes taking months due to the NHS backlog. There's also a digital divide. So some elderly patients really struggle to use the NHS app. And there are, of course, language barriers for non-English speakers, which we have a lot of in London with such a diverse demographic. And then finally, this fragmented communication with hospitals and GPs. The hospitals might fail to update their records for the GPs, and patients may also have to repeat their medical history at every step. So, for example, if they see a doctor in the hospital, they might have to repeat the history that they gave to the GP earlier just because the hospital doesn't have access to the records. So the frustration for doctors is within the UK, it's notorious that doctors have to spend lots of hours of work to do admin. So there's a lot of paperwork, which isn't ideal for doctors, especially as they would love to spend more time with patient care. Digital tools also were meant to reduce the sort of workload, but some actually add to the admin burden and complexity for doctors. There's also an overload of online requests. So patches and accurates actually flood GPs with lots of non-urgent messages, and triages can become very difficult, especially as everything feels urgent online. There's also tech limitations. So AI symptom checkers like NHS 111, online sometimes they can misclassify cases. So for example, a flu might be marked as being urgent, for example, and there could also be data entry errors in digital systems, which lead to delays and misdiagnosis as well. The NHS also has multiple incompatible software systems as well, which results in hospitals and GPs not being able to share electronic records as efficiently as they'd like. So I guess with all these digital tools, it's all about finding the right balance. So um, they can improve efficiency, but they also introduce new challenges. So, for example, for patients, it means that they have easier access to their healthcare, but at the same time, waiting times does still persist. They have more control over their health records, especially with the use of the NHS app, but not everyone can use tech. And for the doctors, it does reduce the phone call burden, but it actually increases online admin for them. And it does improve communications for their patients, but doesn't fundamentally address the systemic delays that exist within the healthcare system. So, what does the future of healthcare look like for the NHS? So, especially with ChatGPT and popularity of that, we are looking to, we're definitely seeing AI-driven chatbots coming in, definitely with triaging of cases. I think large language models can really help with reducing the admin burden of doctors. So, for example, there have been some really interesting startups which have enabled doctors to focus more on delivering patient care. Instead of manually typing their patient notes, what large language models can do is that they can dictate the consultation and automatically embed that into the patient's records, so that doctors have more time with the patients and less time on admin. There's also wearable integration as well. So the NHS is exploring ways on how to sync Apple Health and Fitbit with their records as well. The future could also look in terms of automated prescriptions and referrals. So AI could potentially auto-process repeat prescriptions based on past data. Um, but of course, with AI, there are many challenges as well. So data security risks, patient consent issues, and the over-reliance of AI without human oversight. I think because of these challenges, it's posed to be a difficulty in incorporating AI into healthcare due to these challenges as well. So yeah, thank you very much for listening. So some of the key takeaways that we've discussed today is that the NHS uses a lot of digital tools to enhance patient care. We talked a bit about the NHS app. And we also discussed a bit about how patients and doctors face frustration throughout the journey. Um, but the future of the NHS healthcare is looking very digital, but there's work to be done. I invite any questions that you might have, and also be keen to hear a bit more about what digital challenges you've also faced in your healthcare system and how we can learn from each other as well. Thank you.
Thank you so much, sir, for the enlightening talk. Today, we gained valuable insights into NIH digital and transformative role of personal health records in patient care. Your discussion on navigating NIH services and the impact of digital tools was truly inspiring. Thank you so much, sir. We enjoyed your informative lecture. All right, so now I'd like to invite the participants to share their thoughts. We are now opening the floor for question and answer. Again, we have three options. You may use the raise hand function and unmute your mic. You can chat your question in the chat box, or you can use the Q&A button. Okay? Okay, let me check chat box. Okay, Sir Vinosh, we have a comment here from Dr. Alvin Marcelo. The NEH number is very important for interoperability. It is the patient's key to unlock, aka give consent to allow the healthcare facility to collect and store and display his or her data. And now we have a question here from Dr. Thomas Nicolo Reyes. Okay. Who assigns or allocates the health condition interpretations? Are these sets on the clinician's side each time or pre-assigned based on the condition? Example, vitamin D deficiency, severity minor.
Yeah. So in terms of who allocates it, it will still be the clinician who allocates it. So the GP would, in their patient notes, type down manually what they think their interpretation is of the patient, and type that down. And in terms of the severity being minor, that is something that's already pre-existed coding that's already done prior to so the doctor wouldn't have to manually input the severity. So it's more the clinical interpretation that the clinician will have to do. And then this, for example, the severity would be something that's auto-coded.
Okay, sir, another question from Dr. Thomas. What are the requirements for startups to integrate into the NEH records? Example, AI type startups, is human in the loop a requirement? Are the models required to be hosted locally for data privacy concerns? Or are they allowed to utilize models hosted elsewhere?
Yeah, that's a really good question. So the problem with accessing sort of this large data for AI startups is I think the NHS can be quite difficult to deal with due to sort of consent of patient data. So a lot of what the data startups have to use is kind of created locally. So they create their own sample So, for example, coming back to my previous experiences with my own startup, I think what is very difficult for us was we were working with young children with ADHD. Not only is it very difficult to obtain patient data through a clinic and accessing the breadth of data they might have, it's also much more difficult dealing with children independently. So what we had to do is we had to create a separate consent form and recruit patients our own way as a startup. And I'm sure that's what a lot of AI type startups are also doing at the moment to individually gain consent from patients, create their own sort of data set, testing their models within that small data set, showing its viability within this small data set, then approaching these clinics and saying, hey, listen, we've got this really cool tech. We've proven it within 100 patients with our own local data, and then they can look to collaborating with the clinics to then access a larger data set as well.
Thank you so much, sir. Sir, we have another question here from Miss Gabriel Velasquez of UPM SILab. Based on your experience, what are some challenges patients face while navigating the NIH system?
Yeah, so I think the NHS system is fantastic for patients because it means that they have access to free healthcare no matter what their background is. But of course, there are some difficulties with it. So, for example, getting a GP appointment, like I said, can be quite tedious. It could take a very long time to just get an initial appointment. So it might take a few days unless it's something urgent. Even more when you're in hospital, things such as specialist referrals can take months. So if we're looking at, for example, mental health, the waiting time for things such as an ADHD diagnosis could be 3 to 4 years if you're going through the NHS. If you're having a routine knee operation, for example, the waiting time could be around a year to get that operation. So for a lot of patients, that is a lot of struggle during that 1 year whilst they're waiting to get that operation. And I think that's what I've seen the most in terms of like, frustrations. Otherwise, apart from that, if you are, for example, dying and needed acute sort of attendance by a doctor, I think the NHS is really fascinating in terms of its accident and emergency protocols and being seen very quickly for urgent cases. Non-urgent cases, there is a lot of difficulty.
Thank you, sir. Another question. This is from Dr. Alvin again. From your estimate, are the elderly populations actively using the NIH digital apps, or are there still challenges with their adoption?
Yeah. So there are still challenges with the adoption with this elderly patient group. I think a lot of them from the clinics that I've managed myself don't have the NHS app. Even so, I think we're starting to slowly see an increase of the adoption in the younger age group, and I don't think it's really started with the elderly just quite yet. And I think it's probably the best it's funny because it's the best cohort where the NHS app would be better used for because they have multiple conditions, multiple tests, which would be so easily managed if they had access to the NHS app. However, with the digital literacy and adoption, it makes it very difficult to implement such a fantastic solution for that cohort.
Thank you. Sir Vinosh, this is from Sec Escano. In your NEH systems, do you make use of CPOE or computerized physician's order entry, wherein the orders for medicines and diagnostics are entered? Who uses this? Doctor, pharmacist, nurse, or doctor's trainees?
Um, so I'm not too familiar with CPOE, so I can tell you a bit more about what we do. So like we in the GP clinics, they have a um, normal sort of healthcare system where GPs can access it, so the doctors, pharmacists can enter it, physician associates, physiotherapists can have access to this data pool where they can have access to their personal health records. And for example, if a doctor wants to prescribe a new medication, that will automatically be sent into the system, and then from that be sent to the local pharmacy. So an electronic slip would be sent to the pharmacist so that the patient can go straight to the pharmacist without having a physical copy. And it's all interlinked really well. So it's not necessarily the doctor that has to do that. The pharmacist at the practice can also prescribe medication electronically, so that the patient can go to the local pharmacy without having to have a slip, a manual slip to show their the pharmacist.
Okay, Sir Vinosh, related to the last question, this is from Dr. Alvin. How do the prescriptions written by GPs in their EMRs reach the patient in the NHS provided apps?
So I'm not too sure about that. I haven't really explored that as much because I don't really have repeat prescriptions for me personally as a patient. But for the doctor, what would happen is on the actual platform, you would prescribe the medication, the dose, the quantity, etc. And if it was a repeat prescription, you would mention that on um, the clinicians facing side of the platform. And that would be interlinked automatically because the NHS app is synced to the personal health records so that you can order repeat prescriptions through the NHS app or request the GP to put in an order and request repeat prescriptions as well.
Sir Vinosh, there's a follow-up from Ms. Escano. Are the orders for medicines entered as free text?
So most of the time it's a preset format. So the database would have a huge list of medications. You just have to start typing. So if you were prescribing doxycycline, you'd start typing DOX and it'll automatically come up. And then from that, the drop-down menu will have um, various quantities, doses. So it will all be automatic. However, for example, for more specific medications like ADHD medications, those would be something you'd have to write out in free text because you would prescribe it as the brand name rather than the actual name of the drug.
Thank you, Sir Vinosh. Sir Vinosh, there is a request here from Dr. Alvin, not related to the topic, but can you share more information on the business you set up as an entrepreneur?
Yes, of course. So for me, I decided to go towards working in ADHD because a close friend of mine had ADHD at school, and I saw how with the use of medication, his life like was transformed. He was able to get better grades, focus better. And as I started medical school and I saw for my mental health placement, I saw that ADHD is something not well managed in NHS. It's a really long process to see a doctor. So I decided, how can we look into allowing patients who really need an ADHD diagnosis to be seen quicker? So what we did was, alongside a team, we created an app-based game which allowed doctors to better manage and triage patients with ADHD by looking at their reaction time, their accuracy, and a lot of other metrics that we inputted into an AI model alongside a preset questionnaire that's already used in the standard of care for ADHD. So that was a bit of the idea and how we executed that.
Thank you, sir. Here we have another question here. This is from Chaminda. Thank you very much for the very informative presentation. I believe NHS Spine is used to retrieve client demographics and NHS numbers. How are the duplicate NHS numbers are prevented? How much duplicates are estimated?
Okay, I'm not quite familiar with NHS Spine. Um, in terms of duplicates, I'm not too familiar with there being any cases where patients have had the same NHS number. I think it's very unique that everyone has a very specific number. I think what's the beauty of that is, for example, in London there are a lot of people with the surname, for example, Smith. Especially John Smith is quite a common name. And I think it's very easy to get complicated with very different John Smiths. And I think the whole point of having the NHS number is not only to access their personal health record as a key, as Dr. Alvin has earlier touched on, it's also a really important tool to not sort of misinterpret people because they have similarities in the name, for example. So I'm not too familiar with duplicates from sort of the clinical practice that I've seen so far.
Okay, thank you. We have another question here from Ms. Gabrielle. Can patients order medicines also via the NHS app, or are the different community pharmacies are integrated into the NHS app?
So Um, it depends on what the medication would be. So, for example, if it's something that has to be prescribed by the GP, they'll have to go to see their GP first in order to get a prescription, which they can then access through the NHS app to order. If it was a repeat prescription that's already been prescribed by the GP, then they can order request a repeat prescription through the NHS app because the doctor has given the go ahead of taking the medicine. Some medications, for example, over the counter, I think very similar to sort of, in the Philippines, you can go to a pharmacy and order directly with a community pharmacist. But I think most of the time you have to do see your doctor to get prescribed specialist medication.
Yeah, I agree to that. Okay, next question, sir. In your EMR, is the final diagnosis entered as ICD-10? Who enters, doctor or medical records?
The doctor will enter it.
Okay. Another question from Bulacan State University, Mr. Jameson. In other countries, EMR or slash R is coded by ICD-10s, CPT, HCPCS. How about in London? What did you use? Thank you.
Um, I'm not too sure, to be honest, about the coding. I think we do use SNOMED and ICD-10 from the top of my head, but I'll have to double check that to be sure.
Okay, thank you so much, Sir Vinosh. Let me read this comment from Dr. Alvin. I wish our own ADHD patient in the Philippines would have access to better care. And Dr. Thomas agreed to that. Even the medication supplying access has been proven difficult. Some patients resort to black markets or Facebook groups to get their prescription instead of our pharmacies since they don't have in it stocks. Okay, that is a nice comment. Okay, we have another question, Sir Vinosh. Um, how does the NHS app ensure data privacy when accessing sensitive health information on personal electronic devices? Thank you.
So for the NHS app, when you do create an account, it would require sort of secure password to be set. It also can be linked depending on what device, personal device you're using to, for example, Face ID. So that's something that can be switched on, which adds a sort of another layer of sort of security when accessing your own healthcare records. There's also text message and email verification that you'll be sent a code and you have to input it back into the NHS app. So that those are all the security measures that are put in place if you are using a personal device to access the NHS app for your own healthcare records.
Okay, sir, we have another question. Some hospitals in the Philippines have PHR facilities, but such facilities have limited available capabilities at the moment. Example, laboratory results only. Say, if a hospital would implement a PHR for patient from scratch, aside from appointment scheduling, what other features would the PHR have to consider it as complete as the NAH app has?
So in the Philippines, it's currently just the laboratory results are implemented in the EHR. Just want to clarify.
Okay, thank
So
you.
what would be required then would be access to. I think the beauty of the NHS app, which allows it to sort of be in existence today, is the openness of how patients have the autonomy to access their own data. So they can access everything, even the consultation notes, which I think you probably wouldn't be able to do as a sort of patient if you were in the Philippines because um, I mean I don't know the doctors might be commenting something when you do see a patient and they would be more careful with how they would be sort of writing things down. So what would make a really good personal health record here would be that openness in terms of patients accessing the consultation notes, accessing the test results which they already do maybe having with the electronic healthcare records in the Philippines as well as being able to have more autonomy with requesting things digitally, ordering things digitally. Because I think if you don't have that infrastructure in place yet, then it'll be very hard to create a really good online personal health records if patients don't have the capabilities of doing things digitally.
Thank you so much, sir. Okay, I think we have time for one final questions before we wrap up our today's session. Is there anyone who want to ask the final question? Oh, okay. We have here from Dr. Thomas. Are the patients able to download their patient's data in a certain format, not just within the NHS app?
Yeah, they can. So like I said earlier, I mean, the elderly population, for example, don't have access to the NHS app. It's not like an obligatory requirement for all patients to have an NHS app. I think they have that taken into account. So what you can do is you can get in touch with your primary healthcare clinic and request to have full access to your personal healthcare records. And often, depending on what format you'd like, you could also have it sort of sent as an email, or you can have it as a PDF printed out as a paper copy, and have it that way in that format. And it'll have all the access to all the records since you have been in the clinic and signed up.
Okay, thank you so much, sir. And thank you everyone for all your valuable contributions.
I hope that the participants in the audience has an appreciation of uh, how far we are right now from our other uh, the other countries. No, if we all know how advanced the United Kingdom is when it comes to technology, standardization, interoperability. But I invited Vinosh also to share his perspectives as a citizen and as a medical student and as a user of the NHS digital app. As you know, we don't have the Philippine personal health record system yet, but we will get there at some point in the future. And I think it is because of presentations like this where we get to understand what is already possible, what are the limitations of what are already out there, and what are opportunities, and how similar and also how different our conditions are from the UK and the Philippines. Having said that, again, I'd like to extend a heartfelt gratitude to Vinosh. I hope that he enjoyed going around the Philippines, and I hope that we can continue this partnership even when he is back in the UK, becomes a doctor, becomes a specialist, and becomes a famous researcher. I hope that we can continue collaborating and maintaining the bridge between the UK and the Philippines. Thank you, Vinosh. Thank you, JR.
Thank you, Dr. Alvin.
Thank you, Doc Eloy, and thank you again, Sir Vinosh, for sharing your expertise with us. So, before we formally end the session, may I invite everyone to please turn on their cameras and let's have a group photo taken. In 3, 2, 1, smile. Okay, thank you all for joining us today and making this session a success. Remember, the conversation doesn't have to end here. Once again, I'm inviting everyone to join our IOL 101 webinar series 2025 scheduled every Wednesday. Flash on your screens the list of topics for April. Once again, thank you. This is JR Pingal saying again, catalyzing change one spark at a time. Let's keep pushing the boundaries of digital health together. See you. Bye. Thank you, everyone. Thank you, Sir Vinosh. Thank you, Doc Eloy. Thank you,
Thank
Gabby.
you.
Thank you, everyone.